Diabetes is a disease condition, actually a group of diseases where there is abnormally high levels of sugar in the blood. There are different types of diabetes and they are mostly categorized based on their causes. And they have significant risk factors. So we have family history of diabetes, overweight and obesity, poor lifestyle choices, example, poor eating habits, excessive drinking, the sedentary lifestyle. Age. Interestingly, diabetes, in fact, a particular type of diabetes is more common in adults over 40, and this extends to elderly people, and it is a consequence of a person's lifestyle. And then pregnancy. This, of course, will determine the different categories of diabetes. There are different types of diabetes, but the most common ones are type 1 diabetes, type 2 diabetes, gestational diabetes, and a pre-diabetic condition. With type 1 diabetes, we see a condition where the pancreas is being attacked by the body's autoimmune system. We also have conditions where the pancreas is being damaged due to infections or injuries to the pancreas, and because of that, the body is unable to produce enough insulin, and this affects the way the body processes glucose because insulin is required to regulate the glucose level, and thus we see a condition where there are high levels of glucose in the blood. Type 1 diabetes mostly occurs in childhood, and that is why the most significant risk factor for type 1 diabetes is a family history of type 1 diabetes. It is also, however, important to note that a chronic condition of type 2 diabetes can progress to the pancreas being unable to produce insulin, and that will now be a condition of type 1 diabetes that progress from a condition of type 2 diabetes. For type 2 diabetes, we see a condition where the body doesn't produce enough insulin, or the body resists the insulin that is being produced and is unable to utilize it to process glucose, and thus we see high levels of glucose in the blood. Typically, type 2 diabetes occurs in adults, and it is usually a consequence of a person's lifestyle. However, due to the increase in the rate of childhood obesity today, we currently have type 2 diabetes being recorded in children, and this is also a consequence of their lifestyle. Thus, the most significant risk factor for type 2 diabetes is poor lifestyle choices. This has to do with the food that you eat, choosing the sedentary lifestyle, etc. It is also important to mention the gestational diabetes, which is simply diabetes that occurs while a person is pregnant. This usually resolves after pregnancy, that is, after the person has given birth, but in some rare occurrences where there is poor lifestyle choices, this condition may persist. And the management of this condition is simply to modify the lifestyle and discontinue those things that cause elevated blood sugar levels. It is also important to note that gestational diabetes, when poorly managed, can progress to type 2 diabetes. And then finally, for this series, prediabetes describes a condition where there are elevated levels of sugar in the blood, but it is not enough to diagnose the condition of diabetes. Prediabetes, when not managed properly, can progress to type 2 diabetes. It is important to note that making healthy food choices and exercising regularly can help to manage prediabetes and prevent it from progressing to type 2 diabetes. The easiest way to manage type 2 diabetes, gestational diabetes, and prediabetes is by modifying your lifestyle. Diabetes can be prevented. A lot of people don't know this, but yes, it is possible to prevent diabetes, especially type 2 diabetes, which is largely dependent on a person's lifestyle. Lifestyle modifications help to prevent and even manage diabetes. Now, irrespective of the type of diabetes that you have, what you need to know is that you need to pay attention to your diet and please don't be inactive.